So tell us, Michelle, what inspired you to make the leap from patient to advocate?
Well, this is a bit of a long story, but I think it's worth telling. My journey to patient advocacy took lots of twists and turns through the years. While going through my own treatment plan, I was faced with a lot of challenges and opportunities to also serve as caregiver for other family members. In 2013, my stepdaughter, Trisha, who was from my late husband, Ray, lost her 3.5-year battle with non-Hodgkin's lymphoma. Trisha contacted me and had asked me for help in navigating the healthcare system and to support her in her journey. We all desperately tried to get her well at U of M. We even traveled to Texas, St. Louis, and New York for experimental treatments, which all failed. And unfortunately, she passed away 3.5 years later at the tender age of 23. Later that same year in 2013, I found myself as in the caregiver role again, as both of my parents, believe it or not, had open heart surgery 11 days apart. While mom seemed to get better at first, dad did not. His lungs never recovered from the surgery, and he passed away in 2014. My mom's health then began to fail, and my dad passed after my dad passed. We lost mom in 2019. I had remarried by this time, and in 2016, I took care of my husband, Bill. Now, Bill had 2 occurrences of melanoma, and he was treated at University of Michigan. And we found out actually through pathology and lab results that he carries a genetic mutation that predisposes him to melanoma and renal cancer. So I took my role as patient and caregiver in each and every one of these cases very seriously. And, you know, I believe that pathology and laboratory medicine is at the core of my care and my loved ones as well. And I think you would all agree that it touches every patient's life. I felt that I had a greater purpose because of these tragic life events and really unbearable losses. And I was convinced that these did not happen by accident. And I think you can either become a victim of your circumstance or you can reach beyond that and actually do something about it. And I chose the latter. I really wanted to do something about it. So I also worked in, I was retired at this point. I retired in 2009. I had a 25-year career at a healthcare insurer here in Michigan. So I thought that made me uniquely qualified for what I was going to do, what I felt was my destiny. And so patient advocacy work began at the University of Michigan Health System. I also have been working with the American Cancer Society for many years. And then I got the opportunity in 2016 to do work with the American Society for Clinical Pathologists. So I'm really, really honored to serve all of these institutions. And I really firmly believe it was my destiny.
What are your favorite things about being a patient advocate?
I think really speaking for those who are unable to advocate for themselves, like the elderly, cancer patients, and of course, members of my own family. It feels wonderful to educate and empower patients, to move the needle on important issues, and to make a real difference impacting policy. Quality and safety issues are important in a healthcare system. And I love this quote by Ralph Waldo Emerson, who said, "The purpose of life is not to be happy, it's to be useful, to be honorable, to be compassionate, and to have it make some difference that you have lived and lived well."
I think that's one route to a happy life. Tell us then, what are the biggest challenges you face as a patient advocate?
I've been doing the Patient and Family Advisory Council and patient advocacy role for many years. And I think it's important to understand sort of the history of it here in the United States. the Centers for Medicaid and Medicare Services really asked many years ago that healthcare systems sort of begin the journey down the path of patient and family centered care by having their own councils within. So many healthcare systems out there have this sort of councils, and they've had them for a number of years. And I've witnessed a lot of progress over the years to move things from doing things on behalf of patients towards doing things in conjunction with patients. But I personally sort of feel that the pace has been slowed. And so I would love to see that councils in the healthcare system sort of change things from an advisory capacity, where staff typically brings something to an advocate for comment, and move more towards a transformational kind of a role. I would love to see advocates be involved, be more active. I think the next step in the evolution of this process is to have them really be policymakers. Advisors can provide systemic feedback on quality and safety concerns, truly partner with healthcare systems and organize, moving more from a bystander role to a policymaker. With the advent of personalized medicine and AI and a more educated patient population, I really think that patient advocates are ready to make that real change and to move forward with actual policy items.
Absolutely. Speaking of change, you've been both a patient and an advocate for the past 15 years. What has changed over that time?
Well, it's really a very exciting time, and it's transformational, really, compared to 15 years ago. Patients have had more access to information about their health, including potential options to improve or maintain their own condition. Medical records are available online. There's patient forums, there's blogs, there's websites, all readily available on the internet. And with the healthcare record now fully digitized and available on patient portals, it can be acted on instantaneously. At the same time, in part due to the rising cost to individuals, at least in the United States, more patients are investing in their health to stay well. They have health trackers. They're more, they're the norm now instead of the exception. And savvy patients are beginning to understand how unhealthy behaviors can impact not only their personal health, but their pocketbooks as well. So when patients become ill, they're increasingly focused on learning more through the online. And there's advanced digital communication technologies, which make it possible to deliver chronic care at home. A patient's laptop or a mobile device can now substitute for a doctor's office through apps and virtual visits, which have become popular during the COVID-19 pandemic. So the era of the passive patient, I believe, is gone. And consumers of healthcare in the future, I believe, will demand better tools, personalized treatment plans, and a multidisciplinary care team in the future.
Patients' access to their own data can be a double-edged sword. Of course, every patient has a right to that information, but many need help understanding and interpreting it. What are your views on striking that balance?
Well, you're correct. There is so much information, and in some cases, misinformation out there. So this is certainly an important question. I think actually that clinicians and healthcare systems need to take on an expanded role. Patients need help in synthesizing the information. So I think perhaps through their trusted primary care physicians, clinicians should provide reputable sites to search and do more outreach and preemptively educate their patients. I love the phrase, "nothing about me without me." However, patients must take responsibility too for their own care. They need to help their providers and engage in the treatment plan that's been prescribed. They need to ask good questions and truly partner with their provider so that there is a shared decision-making.
When it comes to patient medical records and test results, recent changes to the Cures Act in the US now prohibit practices that prevent patients from receiving their own data. Are you familiar with the law, and has it made an impact?
Yes, I do believe it has made an impact. The Cures Act, I believe it was signed in December of 2020, and it includes provisions for making pathology and laboratory results immediately available to the patient via electronic portals. And this is to ensure timely access to health information. I read in something by the College of American Pathologists who provided guidance on pathology reports specifically, and they said pathologists should not delay the release of laboratory and pathology results until the ordering physician has reviewed the results. So therefore, things can and by law are populated to the portal immediately. And most healthcare systems have done so, published it immediately with very few exceptions. Many pathology practices have responded with a great deal of anxiety, while others have risen to the opportunity by rethinking the way they provide the results to patients. Some practices have added disclaimers on the patient portal, just warning that your ordering physician may or may not have seen the results before you are seeing them. Others have provided reputable sites and links for patients to do research on the results that have been published to the portal. And others have engaged in something that I am a avid proponent of, and that's pathology patient consultations. This is where patients and pathologists discuss the results of their reports and slides through a meeting.
With so many different options, what do you think should be done to ensure that patients have not only access to their pathology reports and slides, but also a good understanding of that information?
Well, the most important player in a cancer patient healthcare system team really is someone that they never probably have ever had the opportunity to meet or interact with, and that's the pathologist. And I don't think cancer patients, many of them, really understand that fully. So the pathologist is responsible really for evaluating their tissue samples and to determine the type and stage of their disease. So pathologists can impart knowledge about the pathology results and better prepare the patient to participate in their own care. And there is, as I mentioned before, a growing movement in the field to create opportunities for pathologists and patients to interact in what's referred to as the patient pathology consultations, or some call that patient education clinic. I hope this practice of personalized medicine takes off and is offered at many health institutions. It's so valuable.